by human-to-human interaction, person-to-person interaction. And one of the goals of trying to reduce, of curtailing human-to-human interaction is to reduce the transmission of COVID-19. The goal is to prevent the chain of transmission or break the chain of transmission from a young person to an older, to their parents perhaps, to an older person, and ultimately to a nursing home or a long-term care facility or retirement home. Thanksgiving has been a particular challenge, or will likely be a challenge, because we have large migrations of people coming back from college, people going to see their friends and family. And the second item is that when people eat and they dine, they don't wear a mask. So dining is a high-risk activity, travel is a high-risk activity. So we have this natural event, which is Thanksgiving. When will we see a signal? When will we see a signal if that event results in more cases? And assuming people at Thanksgiving dinner on Monday, it'll probably be 5-6 days before people start getting symptomatic. And then it'll be some delay in time before they get a test. So what I would say is that if we want to see where the signal is related to Thanksgiving, we're going to have to wait till next week sometime. And this is, and travel like Thanksgiving is a challenge because it's just not about urban districts and rural districts. So I could give the example of Nipissing College. Nipissing College is in North Bay. Students from Nipissing College province. And it's likely that during that transmission you had interchange or people traveling. We have students from the University of Toronto. That university has a national and provincial distribution of students. There's travel related to that. So Thanksgiving, my core message today is let's wait and see, or we should wait and see what the effect of travel is related to Thanksgiving. And we may see some signals in the next 7 days. Next slide. I think the slide is self-explanatory, but I wanted to share its metaphorical value. This is an older person at a long-term care facility visiting with somebody through a glass. And what this really represents is the policy choices we have to make in public health and as members of the Board of Health and members of the committee today. If we have additional cases at long-term care facilities or nursing homes, this is the kind of visit that we may have to, we have to curtail visits, and it may also mean that visits, if allowed, are through these barriers or through other alternate methods. So what we're presented with COVID-19 is a whole group of policy choices which have a risk and a benefit. And some of that's based on data, and some of it's based on judgment, and some of it is based on risk acceptance or risk tolerance. The people who ultimately will suffer the mortality consequences of COVID-19 are the elderly and the otherwise infirm. And that just has to inform our policy choices as we move forward. In this health district, we experienced that firsthand because we had 27 deaths at Anson Place. And that was both on the long-term care facility side and the retirement home side of it. Next slide. So the next policy choice relates to Halloween. And we wait for provincial guidance, which I hope that will be forthcoming, and which we've communicated is an item that we would like provincial guidance on related to Halloween. So at the health district level, this would be my recommendation. One is our same recommendation always, try to minimize human-to-human or person-to-person contact. Halloween is just not about trick-or-treating. It's about all the activities that lead up to trick-or-treating. People gather, many times multiple families get together. People travel from one neighborhood to go trick-or-treating in another neighborhood. The children and the young people and adults congregate. They travel from place to place. All of that is a risk. It's So it's not an exhaustive risk, but that's a risk. Then there's the fact that Halloween is just not a young person's event. And this I was informed about by a number of people. A lot of adults have Halloween parties. And I guess on occasion, bars have Halloween events. So there's the Halloween activities for children and the Halloween activities for adults. In the absence of provincial guidance, I think that every person has to make a judgment about how they want to participate in Halloween. And then there's the individual choice, or the choices people have to make as households. Do they want to give out candy or not this year? So as we move through this period of time, I think that hopefully the province will provide guidance about what level of Halloween activities, if any, are recommended or directed. But also individuals, even today, can make choices. Now, I realize these are difficult things because once you buy, among other things, once you have your costume for your children, once you put the effort and energy, once you've bought candy, once you decide to decorate the house, it's hard to pull back. But that's the balancing act that we will have to make as a health district and as a province. The other issue is that Halloween is the next big event. And the event after that is Remembrance Day, and the event after that is children or young people returning for Christmas holidays. All of those are items that we have to have some dialogue about among the community related to where we want to be from a risk mitigation point of view. With that, thank you so much. I'm sorry I'm a little late for time, but my apologies on that. I'm happy to answer any questions.
Thank you, Dr. Nitz. Are there any questions, members of the committee? Done. Thanks very much.
Thank you so much.
Marlene, nothing to update from the last set of reports that went to the Board of Health?
Through the chair, there's a couple of follow-up memos that are in your agenda package today, and Ms. Van Dyke will be here shortly. She's just in another meeting to answer any questions. There were no reports on July the 16th, so just those follow-up requests from committee, they'll be presented. And I just want to advise again that we did have a special Board of Health meeting, as everyone's aware. Last week we went to Haldeman just to provide council in Haldeman and the Board of Health on the COVID update and a recommended COVID sustainability plan, which was deferred. And just so committee's aware, we're trying to bring back more information and options to both Haldeman County for consideration and the board next week sometime. So we're working through that. So if anyone has any questions related to that or any guidance, we'd be happy to take that forward.
Well, Marlene, I will just make one comment, and I understand you were in attendance at Haldeman, and the consensus around the Haldeman table was pretty clear that we want more information. But I did raise the point at Haldeman Council that my concern is that that the mandatory programs are kept up and staff are able to answer residents' calls, and that people are being looked after. And I'm concerned about staff burnout. So, I guess my comment to you would be that let's get going here. Let staff to staff. Let's get going here. Our next council meeting is not until October 27th. Our next CIC meeting, I don't know what our senior management is planning to do, whether they're going to recommend we call a special meeting after your Board of Health, your next Board of Health presentation. But I just want to get going here. I just want to know what are both councils willing to accept. And I want to know on the other side of the coin that our mandatory programs are being administered thoroughly, because if they're not, that's when we as councillors, you as staff, are going to start getting the calls, and I don't want to put ourselves into that position. So let's get going here. Let's get this defined and get it narrowed down as to what both councils are willing to support. I think we're spending too much time talking about the fact that we deferred it, and that we did the right thing and saved all the taxpayers' money, and that's great. But we all know that your division needs some support. So what is the answer here? What's the number? Let's get going. That's my comment to you.
So thank you, Chair. We are working towards that. It's just, it takes time to pull staff, and that means, you know, management has to take time from what they're currently doing to do it. So we're actually meeting after this meeting to hopefully pull together the options that have been requested and bring that forward as early as possible as next week, because as you've stated, the longer we wait, recruitment's already challenging. So we would like to move forward if that's the wishes of the Board of Health and Haldeman Council.
Okay, thank you. Any other comments on that subject? Okay, then we'll move on to the staff report on page 6, annual service plan, budget submission, and funding updates. And Marlene, who's going to speak to that?
Thank you. I'm going to ask Ms. Pongratz to present the report, and then we'll entertain questions. Thank you.
So thank you. Good afternoon, everyone. I'd like to thank you for the opportunity today to provide the committee with report HSS 20-11 regarding the annual service plan, budget submission, and funding update. This report is for informational purposes and also to request a budget amendment. The Health Unit submitted annual service plan and budget submission to the Ministry of Health on March the 2nd, 2020. And just to refresh everybody's memory, the purpose of us submitting an annual service plan is to communicate the program plans that we're planning and budgeted expenditures for a given year. And it's also to describe the programs and services that the Board of Health is planning to deliver in accordance with the Ontario Public Health Standards based on the local needs of the community. The annual service plan was completed last year and submitted in 2020 with the assumption of the plan funding change to bring the municipal share to 30% for the public health programs and services. And this was effective as of January the 1st, 2020. The cost sharing change applied to all costs shared in 100% ministry funded programs, with the exception of the Ontario Seniors Dental Care Program and the Medical Officer of Health Compensation Initiative. The accountability agreement that we utilized when we submitted the plan was received on December the 9th of 2019 and included both provincial and municipal sources of funding. In September of this year, of 2020, we received our new accountability agreement for the 2020-2021 funding year. The maximum funding available under this agreement is up to $7,588,800, and that includes $6,073,400 in base and $1,515,400 in one-time funding. This is found in Table 1, and it illustrates the applicable one-time funding that we've received for the 2020-2021, and the base funding allotment is noted in Table 2. This year, the annual service plan did not provide us with the opportunity for a base funding request. In previous years, we were able to do that. This year, we could only submit one-time funding requests. And so the health unit submitted 5 one-time funding requests that are noted in the report, and this totaled $427,900. And we were successful in receiving $135,000 of that. $10,000 of what we received went towards the Public Health Inspector Practicum program, which is our student, and $125,000 went towards cost recovery for retrofitting the Haldeman offices. Table 2 within the report illustrates the 2020 base funding allocation, and the health unit, as I mentioned, had received a total of $6,073,400. This base funding included reductions of $325,400 for the mandatory programs and $17,400 for the MOH, AMOH compensation. Additional one-time funding for 2020, 2021, and 2022 due to COVID-19 is found in Table 3, and that includes new ministry-mandated public health case and contact management software that we were mandated to implement through the ministry. It also includes temporary pandemic pay for the nurses. It also includes a school-focused nurses initiative and a medical officer of health, associate medical officer of health compensation. The COVID-19 School Focused Nurses Initiative will fund 5 FTE nursing staff for the school health program, and that funding goes until July the 31st of 2021. And I just want to mention that funding is not part of the request that we recently presented to the board. Mitigation funding of $325,400 is available for use until December 31st of 2021. Other items that are important to note in the report is that the new accountability agreement for 2020 has the 11 mandatory and related programs reduced to 3 buckets of funding, which allows us to operate with fewer financial restraints, which is nice to see. And please note that also we have submitted grants for extraordinary costs related to COVID, and that has been submitted to the ministry for the 2020 budget year. To conclude, I'd ask that the report be received as information and that the approved 2020 Haldeman Norfolk Health Unit operating budget be amended to include $14,700 in base funding and $892,400 in one-time funding for a total of $907,100, as outlined in Table 4. Thank you, and I'll open the floor to questions.
Okay, thank you, Stephanie. Are there any questions on the report? Councillor Corbett.
Yeah, thank you for the presentation. I note from that you're trying to stick to the 100% figures that we have, and keeping in mind that the wish is not for the municipalities to exceed that amount. I note too that you try to point out in your color-coded, yellow-coded things that we want to key into. Question is, how do you define or outline the criteria for the one-time funding?
So any of the one-time funding that we've received for COVID-19, or any of the one-time funding that we receive from the ministry, usually the criteria for use of that funding is actually provided by the ministry. So we have to stay within the envelope of whatever they've provided with us for guidance. I believe in the package that we submitted, it did include actual, I think, a description of what the one-time funding for the various programs can be used as, and so that's what we use for guidance.
So that's our number one issue, obviously, is COVID. Thank you.
Any other questions to staff on this report? I see no hands, and the recommendations on page 11 of the report. Can I have a mover and seconder for that motion as printed? Councillor Taylor, seconder. Councillor Huffman. All those in favor? It is carried unanimously. So we will move on to social services. We're still waiting for Heidi.
So Ms. Van Dyke is in the building, but she's on another meeting. So I'll just check with her. If not, then I will try my best to answer any questions. They are memo formats and follow up to committee's requests from July the 16th. So I should be able to answer some, but I'll just go check and see if she's available.
Okay. Sure. Sure, you can tell. Let's discuss the online agenda issue while we're waiting.
Hello, committee members. As you know, this week I put forward an idea to go electronic with the agendas, and I see that we've had some requests for printed ones. And the reason why I had gone electronic is we have a lot of people working from home, and Haldeman and Norfolk, or counselors, so I thought it might be a little bit easier than having to come in and get your package, but I guess that doesn't seem to be the case. As well, one of the reasons why I had put that forward for discussion was that we currently don't have courier system running to Haldeman because our Dunnville and Caledonia offices are still not open. So it was an extra expense to have courier sent there, but our offices are hopefully opening in November. So we can take that reasoning off the table and we'll go back to a printed copy if that's what works best.
Comments, concerns? Councillor Corbett?
Sorry, I don't really understand what's being said. Are we saying something about the agenda and the information?
I was just putting forward a proposal to keep it electronic instead of using a courier system or paper copies to get the agenda to Haldeman, or have a Haldeman staff member print it from there to save courier costs, but it's fine. We'll keep it the same way if that's what works best.
And if I may, I couldn't find the agenda on the Haldeman Norfolk website. Is
So-
it there?
It is, yeah.
Well, then I had a hell of a time trying to find it, and I spent most of my morning,
Actually,
rather than doing some research, to look for it.
It actually is on the Norfolk County website under Advisory Committee. I'm not even aware if there is a agenda spot on the public health page. Right.
Kristen,
Sorry,
I
through the
think
chair.
the easiest way here is just for you, when you have that report ready, why don't you just email it to Haldeman clerks? And then Evelyn, I've already talked to Evelyn. Evelyn can print it off for Stu, Bernie, and I, and somehow get it to us, or we can pop into Cuba and pick it up.
That's great.
Usually you're hitting it at a time when we're in for CIC or evening council anyway. So they have the opportunity to print that off and get it to us. Why don't we do that?
For sure.
Okay.
And when I will send it out in an email when it's all complete. I'll attach it electronically, but I'll also put a link to the website there just in case. But you will get it printed as well. Okay, perfect. Thank you.
If I may, I went through looking for information from Marlene, and I don't know whether it wasn't under Marlene, it was under yourself.
I'm not sure which information.
What information, Bernie, are you speaking about?
The agenda.
Oh, okay, the agenda itself. Okay. Yeah, that'll be the easiest.
So through the chair, we'll just ensure that we adhere to the previous process, just to simplify the matter, and we'll keep that going moving forward.
Okay, thank you. Okay, so we're back to social services. Welcome, Heidi. We'll turn the floor over to you.
Thank you, Mr. Chair, and thank you, members of committee, for your patience while I switch from a provincial meeting to our advisory committee meeting. So, thank you. I have provided 2 information memos for you in response to questions that came up at the last advisory committee meeting. The first one is the social housing end of operating agreements, and I thank you, Councillor Corbett, for your question related to that. I'd be happy to review the answer if you'd like.
Councillor
Just
Corbett?
a comment. What I thought in reading that, we were going to lose all funding from the province, and the funding would come from the municipalities rather than the province, but that's apparently not what's being said.
So, Mr. Chair, through you to Councillor Corbett, for what we call our legacy social housing buildings, the buildings that operate rent geared to income, there is federal funding that has historically come for properties that is tied to their mortgages, and that as those mortgages had matured, the federal government previously had been pulling that money back out of the system. But in recent years, within the last couple of years, the federal government has reinvested that money back into what we call the COCHI, or the Canada-Ontario Community Housing Initiative. So that is where we have, as the mortgages mature and the federal money is no longer needed for the mortgages, we get it back in this new pot of money called COCHI in order to reinvest into social housing buildings that have their mortgages matured. That's the one piece. The other piece is the regular annual operating grants. So those are already municipally funded. So that is part of the social housing budget that is presented to councils every year during the levy budget time. And our housing providers, there is a calculation that the province essentially the way the system works is through the Housing Services Act, the province tells us how we have to calculate the subsidy, and then the municipality pays it in levy dollars, which I understand we have had conversations about in the past about the province essentially telling us how much we have to pay, and then we have to pay it, and it's not, we can't change the formula. We don't have any control over the formula. So the annual operating formula has, in essence, 3 components to it. The first is the mortgage and the property taxes, which is a flow through at actuals. It's calculated at the actuals. The second is a rent subsidy, and that is where the housing provider tells us or estimates how much they think that they are going to collect in rent revenue from the tenants, and then there is a subsidy provided between the market rent level and the level that the tenant pays. So that amount fluctuates depending on how much rent revenue they get. The third amount is the operating subsidy, where there are specific operating items such as insurance, hydro, gas, that are eligible for a subsidy. And the province tells us every year what the rate of inflation are on each of those items. So if the price of hydro goes up, then the province says, okay, increase everybody's hydro by 1.5%, for example. But if the price of gas goes down, then they say decrease the amount of subsidy for gas by whatever percentage it is. So that's where we see some fluctuations in that part of the subsidy as well. So where the mortgage ties into that is that once the mortgage is paid off and there is no mortgage payment, they don't get money. They don't get to keep that money. So if we have traditionally given them $20,000 a year because that's how much their mortgage payments are, they don't get to keep that $20,000 to use for something else. It just comes out of the calculation. So as the rent revenue fluctuates and as the operating costs fluctuate, occasionally when we put everything into the calculation, the bottom line might come out as either a 0 or as a negative. However, the province has said if it's a negative, we don't claw that money back, but it just means that they don't get any operating subsidy. I know it's a very technical part of the social housing business, and I've tried to make it as high level as possible, but I also acknowledge that it took me a good couple of years with help from my colleagues in finance to fully understand how it works. So I don't expect everyone to look at me and say, oh yeah, got it, no problem. It is highly technical.
Hoffman.
Thank you. Through you, Chair, to Heidi. So with the part where when the mortgage is paid, so you use that $20,000 amount, so obviously that doesn't go because the mortgage is now paid. Where does that money then flow to?
So Mr. Chair, through you to Councillor Huffman, that would be a decision for the municipality to make, whether or not that would be money that the Social Services and Housing Department would be able to keep to reinvest into the housing system, or whether that would be a savings on the levy.
And are those federal or provincial dollars?
They're municipal dollars. Sorry, Mr. Chair, through to Councillor Huffman, they're municipal dollars.
The 20,000 for the mortgage payment, that's municipal. Okay.
Yes.
All right, I gotcha.
Heidi, most of these mortgages, were they in effect in 99, 2000 when the region was dissolved? That's one of the reasons I was asking this question, just curiosity. Were most of these in effect, or there may be 1 or 2 homes here that were new since that time?
So Mr. Chair, good question. We have not had any legacy social housing constructed in Haldimand and Norfolk I don't know if it was the mid to late 80s or early 90s. So all of these buildings were constructed prior to the dissolution of the region.
Okay. Yeah, it's just a bit, it makes me reflect back because I was on the last regional council when it was dissolved and the province, touted all the benefits from that. But the reality is they set both Hull and Norfolk County up with a budget that was about 25 years out of date. We argued that we were taking over all these mortgages and there was no provincial money to help us with any of this. And they left most of the collective agreements in both counties in the shambles. We had I was involved with our first strike all the big county with CUPE. So it brings back bad memories. But I'm glad to see that some of these are coming to their end. And as you say, the respective councils will have to make a decision on that $20,000. I get you. Any other questions on this report? Okay, then there is no motion, or do we need a motion to receive? I guess we should have a motion to receive the report, moved by Councillor Corbett, seconded Councillor Taylor. All those in favor? It is carried unanimously. Heidi, other issue you want to bring up?
Mr. Chair, I'm happy to answer any questions about the memo on the central waiting list. And I also understand there have been two questions come forward, one from Councillor Patterson about the emergency housing program and one from Councillor Corbett about the housing corporation. So we can move to both of those if there are no questions on the other memo. Any other questions on the other memo? Okay, then we might as well move forward to the added items. Councillor Patterson's first item on the emergency housing program incident.
Thanks, Chair Del Monte. I think staff's aware of why I asked this item to be placed on the agenda. I believe Marlene and probably Heidi and some other staff members were copied on the same email as I was. So it's to do with the emergency housing situation at the Star Motel in Jarvis. I'm aware of 3 incidents this year. There may be more. The first one involved the Doyle family, which lives directly across from the Star Motel. That was dealt with. Then, and you'll have to tell me when it was, if it was early in the summer or midsummer, that actually one of the health and social service employees were injured. My understanding was the program was either suspended or temporarily suspended. I wasn't aware that it was back up running until the email that came forward this past weekend, Thanksgiving weekend, when the Doyle family had another incident that happened. They had someone actually come into their house uninvited. Police were called twice and dealt with it. I believe there was an arrest. So I just wanted to bring it to the committee's attention and ask staff, what is your ideas, or what are we going to do going forward? I would just throw in some comments. I would think the health and safety of the residents should be our primary focus of the neighbors in that area. The flip side of that, there's other considerations. I mean, these folks need a safe, and secure environment to live, which in the case is the motel. I'm sure the owners of the motel who live on site, this has been a big financial help to them in their business. So, I mean, I know there's lots of considerations we have to look at, but I'm throwing it on, I guess, to staff to say, what are we going to do now that we're aware of this incident moving forward? Because unfortunately, and I hate to bring up the policing scenario, but it all goes hand in hand. Luckily, on this past weekend, there was a good response time both times to the incident, but we never know, how many officers are deployed on any given night, and they could be in Hagersville, they could be in Cuga. And if this becomes more serious, we can't, I guess the focus is now on it. We can't kind of bury our heads in the sand because it's being brought to our attention numerous times. So I'll stop talking and I'll ask for feedback from staff as far as what the plan is moving forward.
Okay, Heidi, do you want to start?
Certainly. So, Mr. Chair, through you to Councillor Patterson. So the emergency housing program has, since it started more than 10 years ago, we have used hotels and motels in order to house people who are homeless. At the time when the discussion happened with the councils of the day about starting emergency housing, there was a proposal from the community to build a bricks and mortar homeless shelter, and that was not the direction that Haldeman and Norfolk went in. And it is my professional opinion that that is not the direction that Haldeman and Norfolk go in the future, for a few reasons. One is that a 24/7 shelter is, and this is not the primary reason, it's not the only reason, but the reality is it's very expensive to run, to be able to maintain the bricks and mortar and to staff a shelter 24 hours a day, 7 days a week, all year. The other is that the type of communal living setting for people who are experiencing homelessness and vulnerabilities is not always the safest or healthiest way to support people. Because you could have, if right now we have 19 beds in emergency housing spread out throughout the 2 counties, we could have, if we switch to a shelter, we could have 19 people under one roof, sharing 1 living room, 1 kitchen, 3 bathrooms, maybe 3 or 4 people to a bedroom, and that lends itself to challenges and is not always, I think, the most effective way to support people who are facing challenges with daily living. We have seen that, especially during the pandemic. We have not had 1 case of COVID-19 in our emergency housing program. And I'm very proud of that. And one of the reasons we screen everyone that's coming in, and our setup is that everyone has their own room and people are not allowed to have visitors in their room. So we are automatically, everyone is automatically self-isolated. Other areas have had COVID rage through their shelter system and have had to work really hard to place people in hotels and motels that we've been doing from the beginning. So that's the first thing. The other piece, just to clarify what we closed and what we left open, at the Star Motel, we have our regular emergency housing program, and then we have 1 room that is called Out of the Cold. And the Out of the Cold room is the room that our community partners, primarily the police and victim services, can place people in after hours without them going through our usual intake. And that the incident that happened in the summer, the individual that was responsible was an Out of the Cold client, and that was not the first time that we had some incidents in the Out of the Cold room. So we recognize that there are additional safety precautions that we need to take specifically in relation to the Out of the Cold room, and so we closed the Out of the Cold room in order that we could consult with the police and have them do a safety assessment and provide us with some feedback, which they have done. But our regular emergency housing program continued to operate in that location and in our location in Delhi and in Simcoe. In terms of going forward, the program manager of Homeless Prevention Services and I have been having lots of discussions about the future of the emergency housing program. We deliver what we call a housing first or low barrier program, meaning that we have rules. However, we will take people who have extra vulnerabilities, who don't meet the eligibility criteria in other services, and therefore may be more challenging to support. Because we recognize that if we don't take them in emergency housing, there may not be another option for them. The result of that, or one of the outcomes of that, is that from time to time, we have issues come up, like the 3 that Councillor Patterson has mentioned. we do want to, and I am committing to, bringing forward a staff report, not for November, because our report deadline for November Advisory Committee is actually next week, and we need to do some data analysis around this, and we want to do an environmental scan of similar types of municipalities. So for the December Advisory Committee, we are committing to bringing forward a report that talks specifically about the emergency housing program, the risks and benefits of continuing to offer a lower barrier program, and the risks and benefits of switching to a model where we would have more or stricter criteria in place for admission, and what would be the potential impacts on the program and on the broader communities of switching to that sort of model. As well, we want to review how many beds we have in the system, whether that's enough, whether we can reduce, whether we need more, do an analysis of each of the locations to determine whether we continue or not, and how much money we're spending on this program. So it is our plan, and you do have my commitment that we'll come forward with a further report. And we are reviewing the safety upgrade recommendations from our partners at the OPP to make sure. We've already made some adjustments to the workspace for our employees to increase their safety there, and we have some additional things planned.
Councillor Taylor.
Thank you, and through you. Heidi, what if one of the individuals that isn't meeting other program standards continues to break the rules that are in place within our programming?
So, Mr. Chair, through you to Councillor Taylor, they are discharged from the program. When someone comes into emergency housing and after they've been assessed and when they're placed, we review a participation agreement with them that outlines the program expectations, including things like drug use, illegal behavior, violence, and agreeing to participate with our staff to get themselves stabilized and rehoused. If our guests, our clients, decide not to meet their participation requirements, then they are discharged from the program. And they are then, we try to find them placement elsewhere at a more appropriate service. But ultimately, if they're not willing to work with us, unfortunately, they are out on their own. And that is the reality of the situation.
If I may just follow up, how often do individuals not meet those participation requirements? It doesn't seem like something that would happen very often, but when it does, how often is that?
So, Mr. Chair, through you to Councillor Taylor, as Councillor Patterson has said, we have had those 3 incidents in the last in less than a year. I'd have to get back to you on how regularly it happens, but in talking with our program manager yesterday, she did reiterate for me that our staff are having good success at working with people to discharge them from the program to more permanent housing. I would say we have more people that we are discharging to more permanent housing than we are discharging because of their behavior.
Just as a request, could we see that as a percentage of intakes, and then also percentage of intakes discharged into more permanent housing? I think that'd be really good information to have in front of us.
Heidi, I got you, Bernie. Heidi, what is the occupancy rate on those beds that you mentioned, 18 or 19 you mentioned? What's the occupancy rate on an ongoing basis on those beds?
Mr. Chair, it varies from month to month, and that's something that we can include in our report as well. We have to, as part of COVID, we have to report that to the ministry on a weekly basis. And so I just saw the last weekly report right now, in one location where we have 12 rooms at the Jarvis location, as of yesterday, we had 5 residents out of 12. I don't think we had any in Delhi, and we had 5 out of 5 in Simcoe.
Councillor Patterson.
Thank you. Sorry about my back, Heidi. Just to follow, thank you for the overview of the program. And it's great that we're going to kind of take some positive steps going forward, proactive steps, and maybe revamping it a little bit. But I kind of want to drill down to the affected family in question of why this was brought up. Is yourself or someone from staff going to be in contact with the Doyles to say, this is what we're proposing, this is what's going to happen going forward? Because right now they do not feel safe in their own house, and I don't think it's fair that we defer this to the police to handle. I think they should be hearing from Health and Social Services. I could be out in left field, but can you respond to that?
Mr. Chair, through to Councillor Patterson, certainly that's something that I can follow up on. Yes. In terms of the response to incidents when they happen, in incidents like this, this one happened after hours, and I totally respect that the family, I think, made the right call by contacting the police to have a police response. Depending on the level of the incident or behavior that is occurring, and this gets back to staff health and safety as well. Our staff are trained in nonviolent crisis intervention and in de-escalation techniques, and they use those very effectively. Part of that response is that they are not to put themselves into a situation, if they can at all avoid it, and sometimes similarly, you know, and the situation that happened in the summer was one of those that could not be avoided, unfortunately. But if the staff feels that something is occurring that is beyond what they are able to respond to, or that would put other people, including themselves, at risk, then the direction is to call 911 and to have a police response. But certainly I will follow up with our staff about following up with the Doyle family.
Councillor Corbett.
Thank you. I've certainly had the opportunity to take advantage of the situation before, not as a client, but having people contact me, and I'm pleased that it's there. I do know that on many occasions we don't have people who want to go because of the isolated place that it's in. On the other hand, I can understand concerns of citizens out there, because I too got involved earlier on a discussion about this. Becomes a NIMBY situation. Nobody wants it in their backyard. It's unfortunate we have to look at this, but I'm pleased to see that you're reviewing the situation to see what changes can be made to help the neighbors that speak out. Shouldn't happen. And you know, in Haldimand County and probably Norfolk County as well, we do not have the availability of police services to look after these things.
Any other questions for Heidi or comments on the issue?
Mr. Chair, can I just provide a brief comment in response? Thank you, Councillor Corbett. I would also note that the locations for emergency housing that we have are locations where the business operators are prepared and willing to enter into an agreement with us to operate emergency housing in their location. And that is not the case in all areas. So we choose the locations based on the geographic location. The location in Jarvis is central to both counties. We have to consider that as well. And the amount, we always want to minimize the amount of time that staff are traveling so that we can maximize the amount of time that they spend with the people that we support. And but we also respect the fact that there are some business owners who don't see this as part of their business model.
So Heidi, the last item I have under your division is the shareholders agreement issue that Bernie raised. Can we speak about that now?
Can I just speak on that before we go? Yeah. I'm sure you realize for me, I'm very anxious to get on with this regeneration before my term is up. And I know prior to getting to that stage, we have to have a shareholders meeting. We have to review the shareholders' direction. And I know Haldeman County wants some share in their destiny. We've rescheduled the meeting, and that further puts off those plans. I'm wondering at what point are we now in this process in order to get on with what we want? You know, I see what's happening in the community. COVID doesn't help that we need more housing. If we can get upgraded housing and get rid of the legacy ones, it's to our benefit. However, I have to wait for these to happen, and it's not happening as quickly as I'd like to see.
So, Mr. Chair, through you to Councillor Corbett, I can tell you that the Housing Corporation and their consultants and myself are actively working on the regeneration study and the strategic asset management plan. We are meeting regularly about that, and we're all doing work on it between meetings. So although there has been a delay in the timing of the shareholders meeting, the work on the regeneration study and the strategic asset management plan continues actively. In relation to the question about the shareholders agreement, there was a question that has come up in regards to language in the Housing Services Act about delegated authority. So right now, Norfolk County Council, as the service manager for housing and homelessness, that's what's listed in the Housing Services Act. There is language in the Housing Services Act that says that a municipal services manager can delegate some of its authority to another entity, including another municipality. So the question that I was asked to put forward to the ministry that I have is whether or not Norfolk County can delegate authority to Haldeman County for Haldeman County properties. And that's very much in line with what we talked about when Matt and I did the regeneration plan, and we've had discussions with council and with staff at both counties about who makes decisions over what in relation to properties that are physically located in each county. And I completely respect that. And as I said when I was here in July, it is not my intention to have one county make decisions for another county in isolation of that county, whether it's Norfolk making decisions for Haldeman or Haldeman making decisions for Norfolk. That is not how I see this moving forward. So in terms of the status, the date that was set aside for the shareholders meeting, October 21st, there is a meeting scheduled for senior staff from Norfolk County and Haldeman County to meet to discuss the issue of the delegated authority, and so that can be resolved and included in the shareholders agreement. And there are two afternoons in November, the 25th and 26th, that we are all holding for a rescheduled shareholders meeting. So you are correct, Councillor, that there is a delay in the shareholders meeting by 4 weeks, but in that time, the work on the question of the delegated authority and the shareholders agreement is continuing.
Thank you for that response. I'm looking forward to a good meeting in November.
Councillor Patterson?
Thank you. I just see on the screen that Mrs. Doyle is live. I didn't know if you want to ask her to speak.
Yes, I was just going to raise that issue. So is our members of the committee okay with that? Okay. Janice, can you hear me? I'm not sure she can. She hasn't acknowledged. We can't hear her though.
There you go. Okay, I'll try this. Can you hear me now?
We can.
You can. Okay. I don't see who's there. There's just a couple of initials on my screen, but I thank you for the opportunity to
Hey,
speak.
Janice, just a moment, Janice.
Okay. Yep.
I understand. Okay. Okay. I'm gonna. Well, I think I already did. I did already acknowledge, but next we'll have to set this up as we would at council. So Janice,
Yeah.
you have 10 minutes to make your presentation. He's agreed to let you speak. So I'll ask you to go ahead with your presentation.
Well, thank you. So my name is Janice Doyle, and I live in Jarvis, just outside of Jarvis, across from the Star Motel, which is 4 kilometers east of Jarvis. And we've been having concerns with the residents across the street there, across the road, for quite some time. Even last summer, our 2 teenage daughters have been concerned about going outside on their own, where the residents have approached our property. They've asked for rides, they've asked for food, they've asked for cigarettes, and so forth. We didn't get the police involved until sometime in the spring, and a file was officially opened. But my concerns are growing, especially after an incident that occurred Monday night, where a woman who was a resident at the motel was apparently high on crystal meth and walked right into our home, alarming our teenage daughter, alarming myself as well. This is a pandemic. I got her outside. Long story short, there was an email that was sent to the mayor as well as Mr. Patterson describing the incident. And the woman was eventually arrested because she was found on our property 3 times total, actually. And we're concerned. We're concerned for her health. We're concerned for our health. We're concerned for our safety. My kids are afraid to be in their own home now, and we have to lock our doors when we're home. And no one should have to live like this. So I come before you and the committee today in the hopes of somehow stepping forward with a means of moving forward in resolution, moving forward in a way that my kids will feel safe, that my neighbors will feel safe as well. We're all locking our doors even when we're home because of the residents. And this isn't an isolated incident. My daughter's bedroom window faces the motel. We don't have air conditioning, so quite often she overhears some of the conversations on the still nights of summer when they're outside, including one conversation where one man said to another, "I've stabbed somebody before. I'm not afraid to do it again." So no wonder my teenager is terrified. So I come to you to ask for help. Help keep my family safe. Help these residents get the help that they need. I don't know if we need security on sites, on the premises, some sort of accountability. I don't know what to do. I have now made arrangements for my daughter to have counseling for anxiety, and we're taking one step at a time. But even myself, every time my dog barks, I am alarmed. Every time I open up my back door, I almost have to hold my breath in anticipation of finding somebody out there. So I ask for your help. That's why I'm here. So thank you for allowing me to speak, and I'm happy to take any questions.
Hey, Janice, thanks very much for joining us today and for your presentation. Staff are going to be in contact with you to talk about some initiatives that hopefully will help improve the situation. But at this point in time, I'll ask if there's any member of council committee here that has any questions for you. Anyone on the committee? No questions for you, Janice, at this time. And Heidi, did you want to make a comment to Janice?
Yes, thank you, Mr. Chair. Mrs. Doyle, can you hear me okay?
Yes.
Oh, good. My name is Heidi Van Dyke, and I'm the Director of Social Services and Housing for Haldimand and Norfolk, and the Homeless Prevention Services Program is part of my department. Thank you for being here this afternoon to raise these concerns, and my sincerest apologies for the problems that you have had, and that with some of the residents, and for the way that you and your family are feeling, and some of the experiences that you're having as a result of that. The way I've explained to committee today that the way that the program works is that the residents who stay in our emergency housing program, they go through an intake screening with one of our staff, and each of them signs a participation agreement that relates to their behavior and relates to our expectations with them to meet with our staff to attempt to resolve their housing issue. That site, we have housing support workers who are there during the week, during the day, but I acknowledge we don't have, the owners are on site after hours, but it's not staffed 24 hours a day by our department. The owners are on site after hours. We are looking at the whole program and what our admission criteria is, the rules that we have in place for residents. The police have done a physical assessment of the property and have given us some suggestions for safety improvements that we are working on. And I have committed to bringing another report back to this committee at the December meeting, but that doesn't mean that work isn't going to be taking place in the meantime, because it is. So I wanted to provide you with that update, and certainly if I will connect with Councillor Patterson to get your contact information, and I'd be happy to give you a call and we can have a further conversation. And I'd be happy to hear any ideas or suggestions that you have about changes that we could make that would help make you and your family feel safer.
Okay, thanks very much, Janice.
Thank you.
Okay, so we'll move on with the agenda, and Marlene, I'm seeing the communications, the two items listed as communication is our next item. I think we've addressed everything else. Are there any questions on those two items? Yeah, I'll do that as well. So we need two motions here, actually. Then the first one is to receive the deputation from Janice Doyle as information, moved by Councillor Corbett, second by Councillor Patterson. All those in favor? It is carried unanimously. And the second one is to receive the items as communication as listed. Mover and seconder, moved by Councillor Rabbit, seconder Councillor Huffman. All those in favor of that motion, it is carried unanimously. No other business, no closed session, so we are adjourned until Thursday, November 19th at 1 p.m. Thank you very much. Thanks, Heidi. Don't work too hard over there, eh? This is my fellow manufacturing mate. 35 years I spent in middle management at Stelco, and I'm telling you, I went through 5 strikes, some of them absolutely vicious. I went through the startup in our first coil at the lake. We went through the takeover by U.S. Steel. Oh my God, that had to have been the worst.